Good evening, good evening. My name is Erica Hill, and a special invitation by Compass, Glenda Phillips Hargrove, and the Sisters of the Sand. By invitation, I'm here to provide education to you here at your Pink and White Masquerade Ball on breast cancer awareness tonight. I wish I could be there with you all in person, but I am with you in spirit. Enjoy the education. Just a little bit about myself. So again, I'm Erica Hill. I'm a registered nurse, and I have been for 22 years. I've been so blessed to work in multiple areas of nursing, like mental health, women's health, med-surg, home care, mom and baby, education, and my favorite is education. So again, I'm here to present to you all tonight on breast cancer awareness and to stress the importance of early detection and screening. So without further ado, we'll begin our presentation. So tonight, we're going to understand what breast cancer is, identify some of the risk factors of breast cancer, explore signs and symptoms, stress the importance of early detection and screening. What's your role? What's my role? What's the role in the community when it comes to breast cancer awareness? And at the end, we'll just review some resources and community support that you have. Understanding breast cancer. So every day, our cells in our bodies, they divide and grow and die. Some cells grow out of control. This is the case with breast cancer. As these cells divide and grow, they grow without any kind of normal control. And these cancerous cells grow and they multiply, and they perform a lump or a mass that is called a tumor. There are warning signs and symptoms that we will discuss later on in this presentation. So breast cancer is caused by the development of malignant cells in the breast. And these cells originate in the lining of milk glands or ducts in the breast. So how common is breast cancer? So this year alone, it's estimated that 266,120 new cases of invasive breast cancer are expected to be diagnosed in women in the U.S., along with 63,960 new cases of non-invasive breast cancer. About 2,500, a little over 2,500 new cases of invasive breast cancer is expected to be diagnosed in men in 2018. So not only does breast cancer affect women, but it affects men as well. Of course, more common in women, but still present in men. A man's lifetime risk of breast cancer is about 1 in 1,000. In women under 45, breast cancer is more common in African American women than Caucasian women. Overall, African American women are more likely to die of breast cancer. And we'll talk about some of those reasons later on in this presentation. For Asian, Hispanic, and Native American women, the risk of developing and dying from breast cancer is much lower. So for women, about 1 in every woman will be diagnosed with breast cancer in her lifetime. So 1 in 8 women. Again, breast cancer affects both men and women. However, it's more common in women. Every 23 seconds, someone is diagnosed with breast cancer. Breast cancer claims the life of 100 women daily. Think about that, 100 women. As of January 2018, there were more than 3.1 million women with a history of breast cancer in the United States. This includes women who were currently being treated and women who have finished treatment. A woman's risk of breast cancer nearly doubles. So it doubles if she has a first-degree relative such as a mother, a sister, or a daughter who's been diagnosed with breast cancer. Less than 15% of women who get breast cancer have a family member that's also diagnosed with it. So some alarming statistics there. Breast cancer incident rates in the U.S. began decreasing in the year of 2000. After that, for the previous 2 decades, and there's a theory behind this. So the numbers dropped 7% from 2002 to 2003 alone. And one theory is due to the decrease in the use of HRT, hormone replacement therapy that women use after menopause. And these results were, these were the results that came out of a Women's Health Initiative, a very large study in 2002. These results suggested a connection between HRT, which again is a hormone replacement therapy, and the increased risk of breast cancer. So we'll move on to signs and symptoms of breast cancer, concerns that women have with their breasts. So perhaps the most widely recognized symptom or that a woman would have would be a lump or mass in the breast. As we talked about before, that those cells are growing and dividing and dying, and changes are happening so rapid. But when these cells grow out of control, out of a normal, away from the normal pattern of development, then that lump or mass can develop. So while many women go to the doctor after finding a lump, every woman is encouraged, man is encouraged to be aware of your breast tissue and your nipple tissue. And there are different types of breast cancer, so there are a variety of symptoms related to this. For example, the invasive ductal carcinoma, ICD, which we had the diagram of earlier, is a form of cancer that forms in those milk ducts. And it can cause a distinct lump that you can actually palpate or feel with your fingers. And also an invasive lobular carcinoma, ILC, which forms in the milk glands. And this causes a thickening of the breast tissue. So it's very important to be very familiar with your breast tissue. So because we're all different, every individual symptoms will vary from person to person. And some of the most common signs and symptoms also include those skin changes, such as swelling, redness, and other visible differences in one or both breasts. There may be an increase in the size of your breast tissue or changes in the shape of your breast. So also, there could be changes in the appearance of one or both nipples, and also a discharge from the nipples. And I want to make sure that we're clear that this is different than breast milk, okay? Could also include general pain in any part of the breast. We talked about lumps and nodules as well. Some more symptoms, there are quite a few here. And these can be felt, palpated on the inside of the breast or on the breast. And these symptoms can sometimes be more specific in an invasive breast cancer, okay? Such as irritation to the skin, itching, changes in breast color, or changes, again, in the breast size or shape over a long period of time. A few more signs and symptoms for you. Changes to touch. Those breast tissues can sometimes feel very hard. They can be very tender, warm to touch. There can be a peeling or a flaking of the nipple skin. Your breast can be lumpy or the tissue can thicken. There could be redness or pitting of the breast tissue, like the skin of an orange, how they have the little indurated areas there. That can also happen. What are some of the risk factors? Let's talk about those next. So there was quite a list there of those signs and symptoms. We'll stress the importance at the end of being very familiar with breast tissue. So the exact cause of breast cancer is not known, but it may include the following. Also note that some of these factors women have no control over. These women and men have no control over these factors here. Okay, so we're going to talk about factors that we have control over and factors that we have no control over. So the ones that we have no control over is our family history, hormonal changes that's going on within your body, growing, how we all age, your ethnicity. You are who you are. You were born who you are. Hispanic, Black or African American, Asian descent, Pacific Islander women are also have an increased risk for breast cancer, or those increased risk factors. The time of menarche, that's the time that you start your period. If you have your period begin at a young age, or if you have menopause at an older age. Pregnancy also can put you at risk for breast cancer. Becoming pregnant at an older age or never being pregnant at all can put you at risk. Hormones. We're going to continue with factors here, risk factors. So hormone use, including long-term use of contraceptive, like birth control pills, or post-menopausal hormone therapy. Remember we talked about that HRT. About 5 to 10% of breast cancers can be linked to gene mutations, which are abnormal changes inherited from one's mother or father. These mutations of the BRCA1 or the BRCA2 genes are the most common. On average, women with the BRCA1 mutation have 50 to 65% of a lifetime risk of developing breast cancer. And for women with the BRCA2 mutation, the risk is 45%, so still high risk, almost 50%. And with the BRCA1, it's over 50%. Breast cancer that is positive for the BRCA1 or the BRCA2 mutations tend to develop more often in younger women. In men, the BRCA2 mutations are associated with a lifetime breast cancer risk, about 6.8%. And the BRCA1 mutations are less frequent cause of breast cancer in men. So education to our younger women is very important too. Very important. So we're gonna talk about prevention next. So when we talk about prevention here, in some cases, breast cancer can be prevented. These are those risk factors that we have control over, because remember, those your family history and your ethnicity, the genes that you're born with, we can't change those, but our lifestyle and those risk factors we have control over. So again, there's been some great progress in the research of risk factors. Still, the exact cause, again, I want to reiterate, is not known. These are, again, some control factors that have been identified, but factors, of course, are not limited to this short list. So here we have 4 in 10 cancers can be prevented. And it shows a lifestyle of being smoke-free, having a healthy weight, eating fruits and vegetables, so a balanced diet, limiting your alcohol consumption, having limited access or limited exposure to the sun, eating less processed meats, a diet high in fiber, having an active lifestyle, adding exercise and endurance training to your daily routine. And also we have here eating less salt. Some other things here, I have to look at my slides here. I'm telling my age. Here we have as well breastfeeding if that's possible, and also minimal risk in your work environment, and minimizing certain insecticides, looks like. So those are some of the risk factors. So remember, these breast cancer prevention steps that you can take here in your lifestyle, your daily lifestyle, can reduce your risk of developing breast cancer. Early detection. Let's talk about some of those measures. These are very, very important. Early detection. Know your family history. Be very familiar with your own breast tissue by performing monthly breast exams and also having clinical exams. And clinical exams should be performed at least every 3 years, starting at age 20. That would be by one of your medical providers, the clinical exams, as you are performing your own self-exams as well. Again, be familiar with your own breast tissue, as some women have no symptoms at all. Mammograms are also recommended for women 40 years of age and older. If there is a family history, of course, screenings will be performed at an earlier age. If you have anything unusual that you feel with your fingertips, that you can visibly see, changes in your breast. Remember, we talked about asymmetry, where one breast can be larger than the other. Those changes with your breast tissue where there are lumps, changes in color, any redness or tenderness. Make sure you have this checked out by a medical provider or a gynecologist. And also genetic testing. So right now, mammograms are like the most effective screening tool that we have to use for those images of the breast. And like I said, those are recommended to start at age 40 and for those to be performed every year. Let's go over those behaviors again. Limiting alcohol consumption. Some environmental factors again is any kind of exposure to radiation, being obese or overweight, or any kind of gene mutation. So if you have any kind of personal history of breast cancer in one breast, then there are chances that you can develop breast cancer in the other breast as well. So what's your role? What's my role in all of this? Again, stressing again, early detection and prevention. Be familiar with your own breast tissue. Note any changes in the size or shape of your breast. When you check your breast, you want to assess yourself for any changes not only in your breast, but you also want to check the pits of your arms for any kind of redness, any kind of lumps, any kind of hardness. And if you are high risk, ask your medical provider what screening tool will be best for you. Most importantly, become informed, become empowered. Support, support, support. Support your family, support your friends. You yourself be open and receptive and receive support from individuals. From these individuals, also your doctors and community agencies can also help. Make healthy lifestyle changes. Treatment of breast cancer can be successful if it's detected early and properly treated. This is a very limited list. There's a whole slew of resources out there online provided by the American Cancer Society, breastcancer.org, Center for CancerCenter.com, the Seidman Center Cancer Center that's located here in St. Louis under Washington University Physicians. Susan G. Komen has a Race for the Cure. There are a lot of community organizations. Sister Strut is another one. Check out these websites, be a support to each other, and together let's help with the prevention and awareness of breast cancer. Thank you very much for your time. Enjoy your ball tonight. Tell a friend, tell a loved one. Educate, educate, educate. Get the word out about breast cancer. It's an amazing thing that this is the month of breast cancer awareness. However, we want to be aware, we want to be empowered, we want to be informed about breast cancer and about health, about women's health, men's health every day. Every day. Have a good evening. Enjoy your ball. Thank you. So when we discussed earlier about why certain ethnic groups are at greater risk for dying from breast cancer, some of the reasons is because of the lower socioeconomic status and no insurance, lack of resources, lack of education. That's why those of us who know, who are in the know, it's really important that we educate our brothers and sisters in the community and that we make sure that they are aware of the resources that are available to those who are more underserved population or underprivileged people. A lot of organizations offer free mammograms. They also have mobile units that come around to different churches in the community, and different clinics offer free mammograms. So that's another part of our role, to educate and to support other men and women in the community, so that with early detection and early prevention, that people don't have to die from breast cancer. Okay, because we said that there's the chance of the treatment being successful if it's detected early. So our role is to educate and support.